Did you know that someone has a stroke every 40 seconds in the United States? It's a staggering number, isn't it? And for us, as we get a little older, the risk becomes something we really need to think about. But here's the surprising truth. Many strokes happen not with a sudden, dramatic collapse, but with subtle whispers. Early signs that are often brushed aside as just being tired, or stress, or maybe just getting older. That painful reality is that missing these early warnings can have truly devastating consequences, changing life in an instant for you and your loved ones. You might not even realize something serious is happening until it's too late for the most effective treatments. But what if you could recognize those whispers? What if you knew the secret signs, the ones most people overlook, giving you the power to act fast and potentially prevent a major disability, or even save a life in this video? We're going to look at 7 of these critical early signs of stroke that far too many seniors miss. Knowing these could make all the difference in the world. Stick with me, because recognizing these signs is the first step towards protecting yourself and your future. And definitely watch all the way to the end, because I have something to share with you that might genuinely surprise you and change how you think about this entirely. Let's dive in. All right, so we're talking about those sneaky early signs of a stroke. The ones that don't always scream for attention but are absolutely crucial to spot. It's so important because acting quickly, as in minutes, quickly, can dramatically change the outcome of a stroke. They say time is brain, and it couldn't be more true. The faster blood flow is restored to the brain, the less damage occurs. Many people think of a stroke as someone suddenly collapsing, completely unable to move or speak. But that's not always the case. Often, it starts much more subtly. Let's start with the first few signs, some of which are part of a very simple, easy-to-remember test that everyone should know. Especially as we age, the first sign we need to talk about is something that can be quite unsettling when it happens. And that's a sudden weakness or numbness, particularly on one side of the body. Now, you might think, oh, I just slept on my arm funny. Or, my hand feels a bit tingly. Must be circulation. And sometimes, yes, that could be true. But if this weakness or numbness comes on suddenly, and it affects your face, arm, or leg, especially if it's only on one side, that's a major red flag you absolutely cannot ignore. Let's focus specifically on the face for the first sign. This is often the most visible sign, and it's part of that simple test I mentioned called FAST. The F in FAST stands for face drooping. What does this look like? It might be that one side of the face looks a little bit slack or uneven when the person tries to smile. Ask the person to smile. Does one side of their mouth droop? Does one eyelid seem lower than the other? It might not be a complete paralysis, just a noticeable asymmetry. Think about trying to hold a smile. Does one corner of the mouth just not move up properly? This slight drooping, this lack of muscle control on one side, is a direct result of the brain not sending the right signals. People might miss this because they might just feel a weird sensation in their face, maybe a tingle or a slight heaviness, and not actually look in a mirror or realize that it's visible to others. They might think their face feels a bit odd because they're tired or stressed. But if you see this in yourself, perhaps catching a glimpse in a reflection, or if you see it in someone else, it needs immediate attention. It's not something to wait and see about. Moving on to the second crucial sign, and this is the A in the FAST acronym, which stands for arm weakness. This is another area where sudden, one-sided changes are critical. You might suddenly feel weakness, numbness, or a heaviness in one arm. It's not like your arm is tired from carrying groceries. It's a sudden, unexplained lack of strength or sensation. A common test for this is to ask the person to raise both arms in front of them, palms up, and hold them there. If one arm drifts downward, or can't be lifted as high as the other. That's a significant sign. Again, this symptom is usually on just one side of the body because a stroke typically affects one side of the brain, which controls the opposite side of the body. People might miss this because they might think they're just clumsy, or that they've strained something, or their arm fell asleep. They might try to pick something up and find their hand just won't cooperate, or they drop something unexpectedly. If you're suddenly finding it hard to lift something you normally could, or if one arm feels completely different, weaker, or numb compared to the other, especially if it happens quickly, this is a serious warning sign. Don't explain it away. The third sign, the S in fast, relates to speech difficulty. This can manifest in a couple of ways. It might be slurred speech, where the words sound jumbled or unclear, almost like someone has had too much to drink, even though they haven't. Or it could be trouble finding words, speaking nonsense, or difficulty understanding what others are saying. Someone might try to talk and just can't get the words out, or the words that come out make no sense at all. They might seem confused or unable to follow a simple conversation. This isn't just forgetting a word now and then, which happens to everyone sometimes. Especially as we age, this is a sudden, dramatic change in the ability to communicate effectively. Why might people miss this? They might feel confused and not realize their speech is affected, or others might think they are just tired, confused, or being difficult. If you notice your own speech suddenly sounds off, or if you can't understand simple questions, or if you see this in someone else, it's an emergency. As part of the FAST test, you can ask the person to repeat a simple sentence, like, "The sky is blue," if they struggle to say it correctly, or if their speech is slurred. That's a worrying sign. These first three signs, face drooping, arm weakness, and speech difficulty, are the core of the FAST acronym, and they cover some of the most common and recognizable symptoms. They are called F, A, and S for a reason. The T stands for time, meaning, if you see any of these signs, it's time to call emergency services immediately. Do not wait. Do not see if it gets better. Do not call your doctor's office. Call 911 or your local emergency number right away, even if the symptoms seem to disappear. They could be what's called a transient ischemic attack TIA, often referred to as a mini stroke. A TIA is a strong warning sign that a full stroke might be on the way, and it still requires urgent medical attention. So, we've covered face drooping, arm weakness, and speech difficulty. These are fundamental to recognize, and learning the FAST test is perhaps the single most important thing you can do after watching this video. But these aren't the only signs. There are other crucial early warnings that are often missed because they might seem less dramatic or could be attributed to other common ailments. It's vital to be aware of these too, because sometimes these are the only symptoms someone experiences before a stroke. Let's continue and talk about 4 more signs that you absolutely need to know. Now that we've discussed the critical FAST signs, that sudden drooping face, the unexpected weakness in an arm, and trouble with speaking, let's move on to some other early warning signs that aren't part of the core FAST test, but are just as important, and perhaps even more likely to be overlooked or mistaken for something less serious. Recognizing these can be a little trickier, precisely because they are often missed. The 4th sign to be aware of is sudden trouble seeing in one or both eyes. This isn't like needing new glasses or having your vision gradually change. This is a sudden blurring, dimming, or even complete loss of vision in one eye, or sometimes both. It might feel like a curtain is coming down over your eye, or everything suddenly looks misty or dark. Why is this often missed? Well, if it happens in only one eye, you might not even notice it right away if your other eye compensates, especially if you're not actively using both eyes for reading or focusing. Or, people might attribute it to eye strain, or a visual migraine, or some other eye condition they already have. But if this visual disturbance comes on very suddenly, out of the blue, It's a serious sign that blood flow to the part of the brain controlling vision might be compromised. Imagine trying to read a book or watch television, and suddenly, part of the page or the screen just disappears or becomes blurry, and it doesn't go away quickly. That sudden loss or change in vision, particularly if it affects only one eye, is a neurological symptom and warrants immediate investigation. Don't rub your eyes and hope it goes away. The fifth sign is a sudden, severe headache with no known cause. Now, most people get headaches from time to time, and they can be caused by all sorts of things: stress, dehydration, lack of sleep, even certain foods. But a stroke headache is often described as the worst headache of their life. It comes on very abruptly, like a thunderclap. It's intense, unlike any headache you've experienced before, and it might be accompanied by some of the other stroke symptoms we've discussed, like dizziness or vomiting. Why is this missed? Because headaches are so common, people might just take a pain reliever and lie down, assuming it's just a bad tension headache or a migraine. But a stroke headache is different. It's the suddenness and intensity that are key. If you are suddenly hit with an excruciating headache, completely out of the blue, and you're not prone to severe migraines like this, or if it's accompanied by any other strange symptoms, it could be a sign of a stroke, particularly a hemorrhagic stroke where there is bleeding in the brain. This is an emergency. Don't try to tough it out or wait for the pain reliever to work. The sixth early sign is sudden trouble walking, dizziness, loss of balance, or lack of coordination. This can be one of the most confusing signs, both for the person experiencing it and for anyone observing them. It's not just feeling a bit unsteady on your feet because you stood up too fast. It's a sudden inability to walk properly, staggering, feeling profoundly dizzy, or suddenly finding you can't coordinate your movements. Like trying to pick something up and completely missing it. You might feel like the room is spinning, or you suddenly lose your balance and fall for no apparent reason. Why is this often missed? People might think they are just lightheaded from standing up too quickly, or perhaps their blood sugar is low, or they are just tired, or even that they've had a senior moment of clumsiness. But if you suddenly develop severe dizziness, or you can't walk straight, or you feel profoundly unsteady when you were fine moments before, this can be a sign that the stroke is affecting the cerebellum or brainstem, areas critical for balance and coordination. If you suddenly feel like you've lost your sea legs on dry land, or find yourself bumping into things or staggering, pay attention. Finally, the seventh sign, and one that can be particularly tricky because it affects cognitive function, is sudden confusion or trouble understanding. This is different from the speech difficulty we discussed earlier, although they can occur together. This is about processing information. Someone might suddenly seem disoriented, confused about where they are or what day it is. They might struggle to understand simple instructions or questions, or they might start saying things that don't make sense in the context of the conversation. This isn't the mild forgetfulness that can sometimes come with age. This is a sudden, noticeable shift in mental clarity and comprehension. Why is this often missed? Others might think the person is just having an off day, or maybe they're tired, or perhaps experiencing a momentary lapse due to another health condition. The person experiencing it might just feel fuzzy, or not quite right mentally and be unable to articulate what's wrong. If you notice a sudden, unexplained change in someone's mental state, their ability to follow a conversation, or their awareness of their surroundings, alongside any other potential signs, it could be a stroke. It's about a sudden inability to think clearly or understand. So, to recap the signs we've just covered: sudden vision problems in one or both eyes, that's sudden. Severe worst headache of your life, sudden trouble with walking, balance, or coordination, and sudden confusion or difficulty understanding. When you combine these with the fast signs, face drooping, arm weakness, speech difficulty, you have a more complete picture of the early warnings your body or the body of someone you care about might send. Remember, the key word for all these signs is sudden. Stroke symptoms typically come on abruptly, not gradually over hours or days, and they might not all happen at once. Even just one of these symptoms, if it comes on suddenly, is enough reason to suspect a stroke and seek immediate medical help. Knowing these signs isn't about living in fear. It's about being empowered. It's about being prepared to recognize the signals so you can act without hesitation. Because when it comes to stroke, hesitation can be the costliest mistake of all. Dons dismiss these subtle, or not so subtle, changes. Trust your instincts. So, we've walked through these 7 critical early signs of stroke: that sudden face drooping, the unexpected weakness or numbness in an arm, difficulty with speech, sudden vision problems, a thunderclap headache, trouble with balance or walking, and sudden confusion. It might seem like a lot to remember, but focusing on the suddenness of any of these symptoms is your biggest clue. These aren't things that develop over a day or two. They hit you abruptly. Recognizing even just one of these, if it comes on out of the blue, is the signal you need to take immediate action. Remember how we talked about the FAST test, F-A-S-T, face drooping, arm weakness, speech difficulty, and T for time to call emergency services. That's your absolute minimum takeaway. If you see any of those 3 signs, even if they seem mild, call 911 or your local emergency number immediately. Don't try to drive yourself. Don't ask someone to drive you unless they are taking you straight to the emergency room and have called ahead. Emergency medical services personnel are trained to recognize strokes and can often start providing care on the way to the hospital. And they take you to a hospital equipped to handle strokes. This saves precious time. But beyond FAST, keep those other 4 signs in mind too. The sudden visual changes, that shockingly severe headache, losing your balance unexpectedly, or sudden confusion. If you experience any of these suddenly, especially if you have risk factors for stroke like high blood pressure, diabetes, high cholesterol, or a history of smoking, don't hesitate. These symptoms are your brain's way of telling you something is potentially very wrong and needs urgent attention. It's true. It can be easy to dismiss these things. We all have aches and pains, moments of tiredness, or just feel a bit off sometimes as we get older. That's why these stroke signs are so often missed. They mimic less serious issues. But the key difference is the sudden onset and often the combination of symptoms. Though even one sudden symptom is concerning, it's about paying attention to your body and to the bodies of those around you, and recognizing when something is fundamentally different and has happened very quickly. Being aware of these signs isn't about causing unnecessary panic every time you feel a twinge. It's about empowerment through knowledge. It's about being prepared so that if that moment ever comes, you don't freeze or brush it aside. You know what to look for. And you know exactly what you need to do. Call for emergency help immediately. The faster a stroke is treated, the better the chances of recovery and minimizing long-term disability. Treatments like clot-busting medications, thrombolytics, or mechanical clot removal are incredibly time-sensitive. There are narrow windows of time where these treatments are most effective, and recognizing the signs quickly is the critical first step to accessing them. Talk about this with your family, your friends, your neighbors. Make sure they know the FAST signs and the others we've discussed. Practice the FAST test. Knowing these signs is a gift you can give not only to yourself, but also to the people you care about. Because you might be the one to spot a stroke in someone else. Don't be one of the many who miss these early warnings. Be one of the ones who knows, who acts, and who makes a difference. Taking steps to reduce your stroke risk factors is also a huge part of protecting yourself. Managing blood pressure, keeping cholesterol and blood sugar in check, not smoking, eating healthily, and staying active can all make a big difference. But even with the best prevention, strokes can still happen, which is why knowing the signs is absolutely non-negotiable. Remember what I said about watching to the end for something that might surprise you? Well, here it is. The most surprising thing might be just how powerful you are in this situation. You don't need to be a doctor or a nurse to recognize a stroke. You just need to know these simple signs and have the courage to call for help. Your awareness and quick action can literally be the difference between a full recovery and significant disability, or worse. That's a profound power. Isn't it the power to potentially change the course of a life just by paying attention and making a phone call? That's something truly remarkable. So, please, take these 7 signs to heart. Keep them in mind for yourself and for your loved ones. Share this knowledge. It's one of the most important things you can do for your health and the health of those around you as we navigate these golden years. Remember, small changes in awareness can make a truly enormous difference to your health and happiness, and your independence. Being prepared reduces anxiety. It doesn't increase it. It gives you a plan. I truly hope this has been helpful. It's a serious topic, but facing it with knowledge is the best way forward. What are your thoughts? Have you or someone you know experienced any of these signs? Share your experiences or any questions you have in the comments below. It helps others to read about real-life situations. If you found this information valuable, please give this video a like. It really helps us know we're providing content that matters to you. And please, consider subscribing to the channel. We share lots of practical tips and important information just like this, tailored specifically for navigating life after 60, helping you stay healthy, happy, and living your best life. Don't miss out on future videos that could make a real difference. Thank you for watching. Be aware, be prepared, and take care of yourself and each other. Live your best life at every age.